Back here now, March is Colorectal Cancer Awareness Month, and 22 News is taking comprehensive looks at this disease.
22 News reporter Melissa Torres looked into this type of cancer, what it is, and what preventative measures you can take, as well as what treatment options are available.
Today is the first day of our three-part colon cancer series. In order for us to better understand the third most common cancer worldwide, we need to understand what it is, how it impacts the function of our colon and rectum, and who is most at risk. Colon cancer, or colorectal cancer, is a type of cancer that affects the large intestine, or rectum. It is one of the most common types of cancer worldwide, and it can cause severe harm and death if not treated right away.
Colorectal cancer collectively is basically known as the cancer of the large bowel.
Cancer, in simple terms, refers to uncontrolled cell growth within the body, and in this case, there are abnormal growths centralized in the colon or in the rectum. Dr. Siddiqui, the medical director at Mass General's Cancer Center, told 22 News that these abnormal growths are called polyps.
So the colorectal cancer is actually primarily, one time it is called adenocarcinoma. Now, colorectal cancer usually starts with a polyp, with a little small growth.
Polyps generally aren't cancerous, but some can become cancerous over time.
When it starts, it's usually benign, and then it slowly, if it's left alone, it can become a cancer. Over years, it takes years for a polyp to become cancerous.
These growths can become invasive, growing through the wall of the colon or rectum into nearby structures. And there are 4 stages of colon cancer.
Stage 1 basically means that the colon cancer has not, it's just started, has not gone beyond the very superficial layer of the bowel. Stage 2 is that colon cancer is a little bit more deep into the wall of the bowel, but it has not spread anywhere yet.
Stage 3 and 4 are when these polyps become much more intrusive, making their way into other parts of the body and neighboring organs, making it much more difficult to contain and treat. Dr. Siddiqui says that there are many risk factors.
So age is the biggest risk factor, but more and more we are seeing colon cancer in younger individuals now. So that means that age is sort of moving up a little bit.
In recent years, the guidelines for screening have dropped down to the age of 45 because the mortality rate of people between the ages of 45 and 50 have increased because people were getting screened too late.
So that when a cancer is starting, if it's still superficial, the chances that it has eroded into those channels is less. As cancer becomes deeper and deeper into the wall, the chances that it's going to eventually involve or erode into those channels is high.
People of color are disproportionately impacted as well as those who have family members who have had cancer in the past. It makes them genetically predisposed to develop it. Timely diagnosis, appropriate treatment, and regular follow-up care are important for improving survival rates and the quality of life. The rate of people being diagnosed with colon cancer each year has dropped overall since the 80s, mainly because more people are getting screened. But in people younger than 50 years of age, rates have gone up. And in the next part of this series, we will take a deep dive into preventative measures and treatment options. Working for you, Melissa Torres, 22 News.